India's capital Delhi is going into a 6-day lockdown as authorities contend with a huge surge in COVID-19 cases. Delhi's chief minister says the city's health system has reached its limits and harsh measures are needed to prevent its collapse. Now, the number of confirmed new infections has been breaking records almost daily.
Many in India thought they had got the better of the pandemic. But now the country is being overwhelmed by a devastating new wave. No city is as badly hit as Delhi. As cases explode, hospitals there are at breaking point. Some patients are forced to share a bed. And there's an acute shortage of oxygen. The city's chief minister says the system has reached its limits.
The
beds for COVID-19 patients are filling up rapidly. Patients are being admitted to the hospitals very quickly. Intensive care beds are in short supply, and less than 100 ICU beds are available in Delhi. Authorities in Delhi had already imposed a lockdown over the weekend, ordering all but essential services to close. Local leaders hope the decision to step up the measures will help to mitigate the crisis. Some welcome the restrictions, but others fear if they're not allowed to work, the consequences could be drastic. It is essential that there's a lockdown here because right now the virus is spreading a lot. The problem with the lockdown is us daily wage earners who get 100 to 300 rupees a day. Where will we go? How will we eat? Where will we sleep? Is the government going to come and give us this daily wage? But now, with 1 in 3 tests in Delhi turning out positive, the government says it must act to avert a greater disaster. The fear is that the surge in cases is due to a new, more infectious variant of the virus. They're calling on people to be more disciplined about sticking to the rules. But critics are also asking why religious festivals and political rallies that are fueling cases as participants return to cities like Delhi are still being allowed to go ahead. For tens of thousands of families, such questions come too late. And if current trends persist, then many more will find themselves in the same tragic situation.
And I'm now joined by DW correspondent Manira Chowdhury, who's in Delhi. Good to see you, Manira. So India has just registered its biggest ever increase in coronavirus cases with more than 270,000 in a single day. What is driving this?
What exactly has triggered such a contagious second wave, which is far more infectious than what we saw last year? But there are experts who are saying that the new mutant variant, the new strain as we're calling it, has something to do with it. It is far more contagious than what we saw in the first wave last year. But another thing to note is that there are large gatherings which were allowed to take place for months, including the Kumbh Mela, which is one of the largest Hindu religious festivals. Hundreds and thousands of people every day were gathering in one place, and after gathering there, these people have been going back to different states and different hometowns, taking perhaps the infections along with them. Apart from that, different political parties, including the Bharatiya Janata Party, which is the national ruling party, have been organizing election rallies in different states. So allowing such gatherings to happen and actively organizing such gatherings has a lot to do with why we are in this situation.
Manira, India is the world's leading maker of raw vaccines. How is the country's own inoculation program doing?
Well, India had been struggling in the past few weeks. There were reports from at least 10 states which had raised concerns that they were running out of vaccine supply. I myself did a report last week from a town an hour away from the capital city of Delhi, in which multiple hospitals had to stop the vaccination process for 2 days, or in some for 7 days, because they had run out of supply as well. And even the vaccine manufacturers had been saying that they are running out of capacity. They're not able to meet the demand. The latest on this is that the government has finally provided some more financial support to the vaccine manufacturers in the hope to ramp up the production. Also because from May 1st, the government is opening up the vaccination process to everyone above the age of 18.
Now, countries around the world have put India on a no-travel list. The British Prime Minister Boris Johnson has just cancelled a planned visit to India. What impact is this likely to have on the nation?
Well, if you just talk about UK at the moment, then definitely this move will cause panic also because only 3-day notice has been given. So there's a lot of uncertainty surrounding such travel plans. But yes, Boris Johnson, as we know, was supposed to come to India to talk about a trade deal. And in the Indian economy has been suffering quite a lot since the government imposed a lockdown last year. We've all seen that. So in terms of business as well, in terms of trade, such travel ban being imposed will definitely have implications on the trade side as well.
All right, that's Manira Chowdhury reporting for us in Delhi. Thank you, Manira.